all words right now which very clearly and accurately define what consumers, which then become our patients, what they're feeling right now. It's been what they've been feeling for the past 60 days or so, but it will continue in varying levels for various people. It will continue to be the way that many feel moving forward. And hopefully some of this will ease over time and lessen over time. But today, here is where we are. And this holds true for consumers in general. So as Christy mentioned, we work with a variety of different verticals, healthcare being a primary one. But for our clients that fall outside of the healthcare space, this is the same thing that they are facing right now in terms of re-engaging with customers or re-engaging with clients. It is amplified for us on the healthcare side. And that really goes across the healthcare vertical. It is not just for within a hospital. It's for within doctors' offices, dental offices, individual and private practices, urgent care facilities, up through the ER and the hospital. And so if we know these are the feelings that our patients or prospective patients are going through, then these are the things that we need to quell and to speak to. These are the words that all of us as healthcare marketers are trying to convey. And in many cases, it's what we've been trying to convey for the past 60 days for a variety of different measures and reasons. Some of it has been to continue to ensure that those in an emergency situation are getting care. In some cases, it's been from an appreciation standpoint and working with the community for the thank you to the first responders and those in the healthcare profession. But these are the words and the emotions and the feelings that have to be top of mind as we move forward to forge forward, bringing patients back into our facilities, whether it be our offices, our labs, our clinics, or into the ER or into the operating room. And so I'm asking for you to keep these things in mind with a lot of the strategies and recommendations that we will discuss in the next 20 minutes here. It's very interesting. Telehealth has been a conversation that we've had with all of our clients in the healthcare space for the past year to varying degrees. Some of our clients and the healthcare facilities have adopted faster to using it than others, and some have gone as far as to promote and market it pre the middle of March. There was a forced adoption, both internally within the healthcare facilities as well as externally with the consumer patient base that happened in the middle of March. And so this data right here is coming from Google Trends, which if you aren't familiar with it, it's an amazing tool to use. And you can do a lot of different sorting and filtering as shown in these top 4 categories up here. So what we are looking at is the search term telehealth, the United States, which is a little bit cut off, but you can filter by different countries there. We're looking at the past 90 days in terms of search volume and interest in that term. And this happens to be all categories. You can divide it or drill down further into just google.com or all of the Google properties, or even just YouTube as well. So this is looking across the board, across all properties, anywhere anyone was searching for the term telehealth. And as you can see, all throughout the month of February, the demand was light. And that was something we were working with healthcare marketers on across the board is just growing that strategy over time. Clearly, March 17th is where we saw a tremendous spike. And no coincidence that that was also the date that President Trump, in his White House press briefing, mentioned the word telehealth numerous times throughout that conversation. And we saw many people take action and immediate action at that. And that's that offline to online world, right? Where we see people in that multi-device stage and multitasking, with different mediums. So watching the briefing on TV and simultaneously searching on a tablet, a laptop, or their phone to understand more about telehealth, given, what was happening at that particular time. This data here is coming from one of our clients' campaigns, and we had been running a search campaign for the telehealth initiative. It had been a small campaign based upon, at that time, the importance or priority of telehealth in the big scheme of things for that healthcare organization. So you can see here in a 2-month window, and that would be the, what we're looking at on the bottom of the screen is really January and February data in terms of how many clicks this campaign received, what the cost per click was, and what the click-through rate was. March and April, which is the top line item there, you can see dramatic differences. And the campaign was almost identical, except for 2 things. One, there were a few more keywords and variations of the word telehealth in terms of different types of queries for how people would be searching for it that were added in for the latter time frame. And obviously the budget increased as a result of demand and as a result of necessity given the circumstances and situation. So you can see in the graph really how we progressed. At the beginning of March, you can see everything was static because these changes that we made to the campaign, primarily budget driven, and then it would have been interest and engagement driven. Those really didn't happen until the middle of March. So we're looking at, in orange, plotted the impressions, which dramatically grew right at that same time, around March 17th or so. And then the blue line is the clicks. What's very interesting to note, and something that we all need to really take mind of moving forward with our digital campaigns, is the tremendous spike in the click-through rate. The interest not only skyrocketed, but so did the engagement. So we knew the interest, the impressions, the search volume itself was going to be driven high. But what was also interesting was then the engagement, clicking through to the ad, and then furthermore, the actual downloads of the apps and or bookings of the appointment. Now, what was very surprising to us here at MoreVisibility, and this is something that we continue to research and look into as time is going on, because clearly this is new for all of us, we would have expected an increase in the cost per click, given the competitiveness of the landscape and the new entrants into this particular market for this keyword and for digital advertising. And instead, we had a pretty dramatic decrease in cost per click. One of the theories that we here are researching is, was that a result of a much higher, more significant budget being put forth towards this AdWords campaign? It's not something that should happen, but something that is speculation that we want to continue to research and investigate further. The second hypothesis that we have, which is probably more likely that could be the case, is that the CPC dropped given the unbelievable click-through rate that we were experiencing, because this is just the average click-through rate. So there were certain terms or ads that spiked even higher than the 13% here. So given the dramatic increase in click-through rate, as well as additional content that had been added to the landing page because of the situation and circumstances surrounding this increased demand for telehealth, we believe that all dramatically improved the quality score for this campaign. And we know quality score from Google impacts not only the positioning of your ad, but also the amount that you pay. So you could be willing to pay a much higher max bid cost per click, but you may not have to pay that entire amount if you're pulling a very strong quality score. And two of the factors around quality score are click-through rate and landing page relevancy and engagement. And so we know those two things improved dramatically almost overnight within this campaign. And the speculation is that that helped to then significantly drop down the cost per click, especially given the much larger budget that was put forward. And you can see that clearly in the number of clicks and in the orange line across the graph, the impressions that were experienced. I'm sure most of you noticed trends in terms of telehealth campaigns that you were running and are likely still running in most cases. Younger patients, from the statistics and the initial feedback, and even from the data pre-COVID, younger patients are going to want to continue with virtual visits. And the convenience and the ease in which telehealth works for them is something that they are really going to insist and request and almost demand moving forward. So we're here with telehealth now. What we thought would take us in some cases 12 to even 24 months to fully vet out for the organization, we're here. And that's not going to be able to be turned off just because the organizations are back up and running and fully operational. The same would hold true for practices, individual offices, and even mental health offices as well. So we need to work moving forward in terms of making sure that those who really enjoyed that experience, even though they were forced into it because of the circumstances, if they want to continue on with that type of experience and engagement with your facility, that we're prepared to be able to do that. Unfortunately, given the status and the landscape right now, many older patients are going to be forced to continue with virtual visits. Their adoption with technology, we know, is much lower, and their comfort level with the telehealth experience is much lower than it is for younger patients. But from a safety perspective, this may need to be the case, at least for the foreseeable future. And so therefore, we need to be mindful of how we can help overcome some of the challenges that they've stated well before the pandemic occurred, so that we can get them more comfortable with using the telehealth platform and engage in a more positive experience moving forward if it becomes part of their new norm.